I'll just say that this social worker was one of the most beautiful people that I've ever met in my life.
Clinical social worker Juliet Suarez is remembering her colleague, a 31-year-old fellow social worker who police say was attacked and stabbed multiple times in the neck and shoulder by a patient armed with a 5-inch kitchen knife. It happened Thursday, the victim passing away from injuries Saturday. Suarez says the incident is devastating but should never have happened.
Members have been raising safety concerns for a really long time. Workers have been complaining about safety for years, and this is something that should have never happened.
The suspect now in sheriff's custody. The attack happened in the HIV ward of the hospital, a ward that does not have a metal detector. According to the Chronicle, staff had raised concerns about the suspect who threatened several hospital employees weeks before the stabbing. The day of the incident, the suspect reportedly went to the San Francisco City Clinic in Soma to look for a doctor he was targeting. The doctor wasn't there, so he went to the General Hospital. Union leaders are calling for a security review.
We are demanding a thorough investigation into what allowed this to happen and what changes need to be made so this never happens again.
The Department of Public Health says it's working with the hospital to strengthen security, having already taken steps like adding more security, limiting access points, and speeding up the installation of weapons detection systems. The San Francisco Deputy Sheriff's Association says it warned such a tragedy would happen when the Department of Public Health cut deputy positions at the hospital, saying this was not a random, unforeseeable incident. Zuckerberg San Francisco General Hospital's own data shows years of serious assaults and weapons on campus. Deputies, nurses, and social workers told DPH that pulling deputies off high-risk units and posts and replacing them with unarmed cadets and distance response teams would get someone seriously hurt or killed. On December 4th, that prediction came true. Clearly, a lot to be discussed when it comes to the safety and security of employees. Right now, fellow clinicians, fellow social workers are now gathered here at the front of Zuckerberg San Francisco General Hospital to mourn the loss of their social worker friend. Clearly, an unbelievable loss for this hospital, and next steps will soon be discussed about safety and security here at this hospital after this terrible incident. We're live in San Francisco. Cornell Bernard, ABC 7 News.
Cornell, thank you.